Welcome to Trichy Truths, the podcast where we deep dive into the real underlying causes of trichotillomania. I'm Laura, a clinical nutritionist and founder of Trichy Nutrition, and I'm here to help you uncover the hidden connections between your body, mind, and the hair pulling cycle. In each episode, we're going to explore the root causes for your hair pulling behaviors, from nutrient deficiencies and gut health imbalances to stress, hormones, and a lot more, because trick is never just a habit, there's always a bigger story behind it. If you're ready for insights, strategies, and support that go beyond surface level solutions, you're in the right place. Let's get started. So today we're going to be talking about blood tests. So it's one of the most common questions that I get on my Trichy Nutrition, because I do often talk about, looking for the underlying deficiencies and imbalances. And it usually starts with looking at a blood test. Of course, I want to look at all of the symptoms as well, but I like to really look at a blood test really, really closely. So I'm going to go through today what blood tests we need to ask our doctors for, what the doctors are missing when they're looking at these results. I'm going to explain about reference ranges, and we're also going to talk about each test. So let's start with what blood tests we need. So the ones that I like to something that I also want to clarify is, part of the program that I do for Trichy Nutrition is a lot of people ask me, do we order the blood tests? How do I get them to you? How do I order them? Obviously, it's different in different countries. I know here in Australia, we can go to our general practitioner, so the local doctor, and we can usually at least annually get a blood test done for free under Medicare. They might not ask for full panels of each thing, like they might just do iron or just do ferritin or just do thyroid stimulating hormone and not the other, part of a full thyroid panel. But what we're looking at is still good enough, like if we just want to get a good range to start with. So these are the ones that I generally ask for. So we look at general chemistry. So a general biochemistry panel will usually have your electrolytes, so sodium, potassium, chloride, and bicarbonate. And I will be doing an upcoming podcast about mineral deficiencies. I've been writing about it a lot on Trichy Nutrition lately, is looking at that electrolyte imbalance and how electrolytes and minerals are affecting basically body functions. And then usually as part of that, you might also get kidney function and you might also get liver function. So in kidney function, you'll look at urea and creatinine. And the liver function, you'll see your bilirubin, usually your, and then a whole heap of different liver enzymes, and then also like your total protein, albumin, globulin. So we look at a whole heap. Liver function really does give me a lot. So when it comes to looking at these underlying deficiencies and imbalances, the liver function, like it really comes down to liver function and gut function. So we're often not absorbing things properly and we're not detoxing properly. And we really need the liver and the kidneys to be, detoxing and filtering a lot of these outside environmental toxins from our bodies, because we're exposed to these things all the time now. So that's part of that general biochemistry. Often I'll also say just make sure there's a liver function test in there included. I also like to look at a lipid profile. So that's your cholesterol. So your total cholesterol, they'll look at the HDL, the LDL, the triglycerides. This does give me a good picture. We do need cholesterol for a lot of things in the body. So digestion of fats, we need it for synthesizing vitamin D from the sun. I do find low cholesterol in a lot of my trick clients. So looking at a lipid profile is a good idea as well. I also like to look at iron studies. So, and when I say iron, we call it iron studies here in Australia, but you might just call it an iron panel. So we look at iron, we look at transferrin,
We look at transferrin saturation, so how much is actually getting into the cell, and then we look at ferritin, which is the storage of iron. So again, if they only include 1 or 2 of those markers, it can be super annoying. So it's nice to get a full picture. Like if we just had iron, it doesn't give me much information. That just tells me what iron is being circulated around the body. It's not telling me how it's being utilized, how it's being absorbed, that sort of thing. So we need that full picture. We also want to look at vitamin B12 and folate. So they're super important for neurotransmitters, for brain function. So there's something that we definitely want to look at. Usually they might be low or extremely high if we've got methylation issues. And if we've got methylation issues, means we're not activating folate properly. Usually we're not detoxing properly as well. So I also look at a full blood count, which has all your red blood cell markers and all your white cell markers. So even if we don't get B12 and folate done, just by looking at the red cell markers, it tells me a lot about probably what's happening with B12 and folate. So for instance, if we've got a low red blood cell count, like we need B12 and folate to make those red cells. So, and then you might see red cell distribution width might be really high if we've got some methylation issues. So these are the sort of things that I'm looking at. And then we've also got a thyroid panel. Often if there's no autoimmune or no thyroid issues in the family, the doctor may just ask for a thyroid stimulating hormone, which can give us an idea just to start, but it really is a good idea to get, the thyroid antibodies, the FT3, the FT4. There's a whole panel of thyroid hormones. Gives us a clear picture of what's happening with the thyroid rather than just getting the TSH. But if your doctor only requests the TSH, so the thyroid stimulating hormone, as a first, and then waiting, if it is elevated, then they might do a full thyroid panel. And then we've got vitamin D. So you've probably heard me talk about vitamin D a lot. I know a lot of people get higher, hair pulling urges during winter time, and honestly 95%, even my clients in Australia, are vitamin D deficient. Okay, so looking at that vitamin D. Now I know a lot of people will say, well, I went and got a blood test, I had it done a year ago, the doctor said it was all normal. Now something that we need to know is about the reference ranges that we use for the blood test. So with these reference ranges, the doctor's job is to diagnose conditions and then treat these symptoms. Okay, they're not looking for optimal health, they are looking for diagnosis. So for instance, vitamin D, if you are low and you are below this threshold, so it's usually below about 30 nanograms per litre, or if you're in Australia or Canada, it is below 50 or 60 nanomoles per litre. But I like it over, in my American clients, I like it between 60 and 80. And for my Aussie clients, I like it over 100 at least, okay, if not over 120 nanomoles per litre. So, but I'm looking for optimal health. We're not looking for, so the doctor's going to see it low and, but you're at higher risk. They're looking at risk factor. So they're looking at if it's below this amount, with their reference ranges, you are at higher risk for this disease. So that's what they're looking to do. And if you're at high risk, then they'll start to watch for that disease, and they watch for other symptoms that could be leading towards a diagnosis of something, okay? But as a holistic practitioner, we're looking for optimal health. We want you to feel your best. We want the body functioning at its absolute best. And we're looking for those early signs to make sure that we're not down that path of having, we want to prevent, basically. We're there for prevention and preventing. So I don't use those normal standard reference ranges. So, and I'm looking at all of these panels that I've just mentioned. I'm looking at these panels and how they fit together as well. So we're looking, the way that the liver works affects the gut. the way that, your electrolytes, if these are low, it's telling me how you're managing stress. And we're looking at all the connections and how these imbalances are affecting you. So of course we look at all your symptoms as well. But that's what we're trying to do. So even if the doctor, I know I actually had, a client yesterday, that mentioned that the doctor said all the labs were fine. So is there another testing that I can get done? And yes, there is other testing, but I hadn't actually looked at her bloods yet. And I was like, pretty much 95% of my clients will say the doctor ticked it all and said the labs look normal. However, you're pulling your hair, you've got all these other symptoms, you're fatigued, you might have restless legs, you might get heart palpitations, you might, have IBS or digestive type symptoms, you're not sleeping well, then there's something going on there that we can pinpoint inside of this full blood test. Okay, so definitely looking at all of this blood work, and getting someone with an eye. So obviously if you've got trichotillomania, that might be why you're listening to this podcast. But if you've got trick, I'm looking at it through a trick lens. But you could also go to a naturopath or another natural health practitioner, some sort of functional medicine doctor that's going to look at reference ranges a little bit different and be looking for those underlying deficiencies and imbalances that are causing all of your symptoms. Because I guarantee hair pulling is not the only symptom that you're struggling with. Every single person that I see in my clinical practice has other symptoms. So today we're talking about blood test. I'll talk about other testing later. The blood test is just that first port of call. If you have a child that is, deadly scared of needles, there is other testings that we can get, whether it be a urine test or a hair tissue mineral analysis. There are other ways that we can get some data to start looking at underlying deficiencies. However, if you can get a blood test, whether it be an adult client or a child client, so a lot of people might come to me and go, nope, my child won't get it. But then I think they see the disorder, I should say, progress, and then they just sort of bite the bullet. I even did it with my own child, where I was seeing some different symptoms and I was like, nope, I've got to bite the bullet. I've got to go and get her a blood test when she was about 7 or 8. And it gave me just so much data that I could work with. So I definitely encourage, sometimes it's the parent that is, holding back and going, oh, I don't know if they can handle it. But sometimes we don't realize, how well they can actually handle something like that. However, if you've had a bad experience with it before, I would recommend not putting your child through that again and looking into other testing that we can do, because obviously we're not trying to cause more stress and more trauma in a child that's already dealing with a disorder that, is very hard to understand. So that's what I would be looking at. So how the program works is we can start off with an initial. Sometimes we'll do just an initial and then we'll move to a blood test in the second session. Some people just want to get started, get things going. So we can do a double session. So it's basically the initial and the blood test. So if you've got blood tests ready to go, I like to use blood tests that aren't more than 6 to 12 months. 6 months is probably the longest I'd like. But for instance, if you've got a child that had a blood test a year ago, doesn't want to get another blood test, I would definitely look at that blood test as the initial, and then we could look at getting something else for another snapshot, whether it be a hair tissue mineral analysis or some other heavy metal mineral testing done, so that we can get an updated version of where their health is at. So usually we'll get that done and we'll get on to a session, and I sit there and I explain every single marker to you, exactly what that marker is, exactly what the level is telling us, and how it's connected to their symptoms. So we go through all of that. Yes, it's a lot of information, but as we go through it, you can ask questions, you learn a ton. And then after, I send a full blood test analysis report, which basically has everything that we've discussed on that session, and everything can go through. You can have a read, and then you get to ask follow-up questions. So inside of the software that I use for my clients, they can ask questions, so voice or text message, and I get onto that pretty quickly. So we go through that, and then you can ask follow-up questions afterwards. And then after we've done that blood test analysis report, I also do a personalized treatment plan. So we'll have supplements in there. We'll most likely have supplements because there's usually some big deficiencies and imbalances happening there. We might change the food around a little depending on, where your child is at or where you are at. Even I've got adult clients that are, super busy. We can't always prioritize, we've got to work in these changes. We've got to implement these changes where what fits your lifestyle. So I know we are all extremely busy. We are go, but it's fitting in what we can. Often we'll function better once we make time for these things. But that's basically how it works. And then, after that initial, we look at going forward, we might look at further testing. And as we go through treatment, we look at, okay, what's worked, what hasn't. So as our body responds to these supplements or to these food changes, we continue to work through them. That's what we do in the program. So where it takes time to reverse these imbalances and these deficiencies. So the body is able to do it. We've just got to help it do it. So that's a little bit about the blood test. If you've got any further questions, I'm hoping that I've answered a lot of them here. Like I said at the start of this podcast, this is one of my main questions that I get asked is about, how do I do the blood test? How do I get that to you? So basically, in a nutshell, it's you get it from your doctor. So I know in America, there's different insurances and things like that. So we try to get all of those. If we can get a full lot of blood tests, if not, if we can get 8 out of 10 of those, that's great. But we'll try to get as many as we possibly can. There are also other places where you can order them yourself and pay for them yourself. In Australia, I try to tell clients to go to the doctor and just ask because it can get covered on Medicare. But if for some reason there's some tests that they won't do, we do have, there's things like imedical.com or iscreen.com. I don't know if they're .com.au, but you can look up those, and there's probably, especially, I'm sure there is in the US as well. I think I've had clients order them themselves, where you can actually order them yourself online, go to the local lab, get it done, and then the results get emailed back to you, but you're just out of pocket. The last time I looked, which was only a couple of weeks ago, so it's the start of 2026, you could get that full lot of bloods through imedical.com.au, I think, for roughly around 400 Australian dollars. So that was for my Aussie clients, but you would have to look into that. But most people go to their pediatrician or their family doctor to go and ask for that blood work. Usually, if you haven't got blood work done within the last year or two or longer, they're usually willing to put blood work through for you. So, and then it's once you get those results, you upload those results to me or send them through, and I sit there and I analyze them before we jump on a session. So hopefully that answers all of your questions, and bye for now.
Thanks so much for tuning into this episode of Trichy Truths. I hope it gave you some clarity and a deeper understanding of the root causes behind trichotillomania. If you'd like to keep learning, you can find me on all of your favourite social media places: Facebook, Instagram, and TikTok. Here I share tips, client wins, and resources every week. For video content and deeper dives, head over to my Trichy Nutrition YouTube channel. And if you're ready for more personalised support, you can book in for one-on-one sessions or a treatment package with me. Here we will work together to uncover your root causes and build a plan tailored just for you. Don't forget to subscribe so you never miss an episode, and I'll see you next time.